issues. Good afternoon, Ayanda, and it is over to you.
1, 2, 3, 4.
Well, a very good afternoon and welcome back. It's the 21st
10.
International AIDS Conference, and I tell you, it's a buzz of activity here at the Durban ICC. Inside the main plenary, discussions are continuing. It's back-to-back sessions. We've got 18,000 delegates who are here. They've come from over 180 countries. We've got scientists, we've got ambassadors, we've got heads of state, and you've just heard there earlier on from the UN Secretary General Ban Ki-moon. At that press conference, he was accompanied by our Deputy President Cyril Ramaphosa. We also had another world-renowned ambassador, Charlize Theron. The list is endless. They are all here today, part of this conference, to say the world needs to come together to take a stand to fight HIV and AIDS. It's not only what's been happening inside the main, as I said, the main plenary sessions. We've also been having activities outside of the conference. We've got parallel events that are taking place. The civil society, there are hundreds of civil society organizations that are here. We've just had an opportunity, in fact, to go to the Global Village, and I tell you, that is the place to be. So we will be giving you, as throughout the week, information and everything that will be happening from the Global Village. Earlier on, we also spoke about that march by the TAC, the Treatment Action Campaign, together with other civil rights or civil organizations, community-based organizations, NGOs, all joining to come and hand over a memorandum to the policymakers. They want action. They are speaking about access to treatment, and just talking about treatment. A conference like this is very, very expensive. It takes a lot of money to run an event of this magnitude. And just joining me now is one of the sponsors of this event, and that is Anglo American. And with me, I have Dr. Stefan van Bocht. Dr. Stefan, thank you very much for your time. Firstly, just tell us Anglo American and your involvement in the 21st International AIDS Conference.
Well, I think, as you mentioned, we're one of the important sponsors of this conference, and we feel that it is right of us to do so, because we were here 16 years ago when people were asking for treatment, for drugs for the HIV infected people, and now we're here at this important point when we see an end to the epidemic. There's a global target of ending AIDS as a public health problem by 2030, and as a private sector we want to contribute to that partnership.
Doctor, speaking about a private sector, of course, and this has been the concern from civil organizations, NGOs who are working with people affected or not affected as well, and just in the respective communities, and they are saying that there needs to be funds, and that is why they aren't able to continue with their work. And I'm sure, as a leading company and business who are supporting these programs, talk us about the importance of business response to AIDS.
Well, I think the business response on the first level is, of course, for our own workers, our employees and their dependents, and we're taking care of that. But I think we're setting examples also for other companies to follow the lead that Anglo American is for the moment having, and we're also setting the examples for governments in partnership with governments, with other organizations. I think this is a fight that we cannot win alone. I think that is for us an important part. We go into the communities as well. I think we are doing well. A lot less people are dying from HIV than they were 15 years ago, and now we have to look at the prevention, because still too many people, too many new infections are occurring. Again, we can set an example, and we can lead together with UNAIDS, other partners organizations, and lead the fight against HIV/AIDS.
And I know with your company as well, HIV and mining, that has been quite a concern. What are the programs that you have? And it's not only addressed, I understand, at your employees, staff, but you're also looking at the communities in which you operate.
Absolutely, we're looking at the communities we have. We invest in the communities to be sure that they have access to the HIV treatment. We will also invest into even more in prevention and awareness building, so that people know how they can prevent it. And we have to think also about stigma, because I think the stigma is still there, and it's really the threshold for people to come for testing. We have to reduce the stigma. People have to be confident. We have a policy of more than 30 years of non-discrimination. I think we showed the example. I think it needs to happen now everywhere.
And I understand you also have a partnership with UNAIDS. Just tell us
Yes,
about that.
absolutely. As I said, if we want to look forward to the end of the epidemic in 2030, you have to start by getting tested and knowing your status. We don't want any more hidden cases that die unnoticed, that transmit disease. So we've gone with the campaign #ProtestHIV, and we've given our support to that, and we can. That way we want to encourage people to go and test. I mean, you can take a selfie and post it on under the hashtag #ProtestHIV and contribute and support this action. So let's get ourselves tested, let's know our status, and that is the first step on the 15 years long route to ending the epidemic.
I just want to go back to business and of course other companies that you sit with and other that you have relation with or do business with. What has been their response, and are they heeding the call that you're making to business to come in and assist?
I think you have companies who are very enlightened and are really doing the same thing. In that sense, we're not an exception. Unfortunately, we still have some companies who are a bit lacking in their enthusiasm to the response, who think it's just a problem of government. Some people even think that HIV is controlled. This is a wrong opinion. I think there's still too many new cases, as I said before, so we have to encourage them to do better and do more. Let's just join in the action. Every business should have a workplace program. Every business should take care that the wives and the children of the workers are being tested and have access to treatment. So that's the call we would like to launch today.
Dr. Stefan van Pocht, thank you very much,
My
sir,
pleasure.
for your time, the Group Head of Health at Anglo American. Well, certainly a lot is still going to be taking place here at the AIDS conference. Remember, of course, we've got the official opening tonight, and we're expecting that the main address by Deputy President Cyril Ramaphosa. But for now, it's back to studio.